Many people in mental health crisis fear that if they dial 988, the Suicide and Crisis Lifeline, law enforcement might show up. But new data suggests that only happens to around 1% of callers. The National Desk, Jeff Harris, joins us. Jeff, that fear is a lot more widespread than many people realize. You took a look at the numbers tonight. What can you tell us?
According to a survey put together by the Pew Charitable Trust, Dee Dee, 1 in 5 adults, 20%, worry that if they use 988, either law enforcement will show up or they'll be forced to go to the hospital. According to new data from Vibrant Emotional Health, involuntary emergency rescues happen to around 1% of callers. Vibrant's Director of Research and Evaluation telling CBS News that involuntary intervention is the absolute last resort. You want to make sure you're engaging with people who are in crisis and empowering them so you don't have to go in that direction.
The intent is behind 988 is to provide some little bit of mental health coaching with enough to maybe calm the situation down and point them to other resources that would be available.
According to 988's policies, counselors are urged to use the least invasive intervention possible to respond to suicide attempts. But if those de-escalation attempts fail, involuntary rescue can become an option. According to the Department of Health and Human Services, since 988 launched back in 2022, the service has answered over 10 million calls, texts, and chats.
Legal